Technical team, I'm continuously getting a bell voice. मुझे कंटिन्यूअस बेल वॉइस आ रहा है. टेक्निकल टीम.
नहीं आएगा अभी, हम बंद कर दिया.
हाँ, ओके. Yes. So good morning, everyone. Today we are going to talk on infection prevention and control. Basically, infection is invasion of body by the harmful microorganisms. And the current pandemic has taught us how infection and infectious disease are great burden to the society. The fundamental principle of modern healthcare is prevention is better than cure. And hence, there is an urgent need to re-establish the basic infection prevention control measures, which have been overlooked or played a very less important role in controlling the spread. And to understand this concept of prevention and control, we have with us today Dr. Shalini Gore, Madam. Madam is MBBS from MIM-SR Medical College and MD from MGM Kamote. Currently, she is an associate professor at Tirna Medical College and Hospital. She was an ex-infection control officer, ex-lab in charge of COVID PCR lab. She has experience in doing NABL and HAI. And currently, Madam is also director of Pure Advanced Clinical Microbiology Lab at Khargar. Madam, over to you.
Thank you, Dr. Falguni, for the kind introduction. Before starting for the webinar, I would like to thank the management coordinators and the organizers for giving me such a beautiful opportunity, presenting me to the group of students speaking on very important topic, that is hospital-acquired infection. And I'll be covering this topic. So I will share my screen. Is it visible?
Yes, yes.
Fine. So guys, today's topic for the webinar is hospital-acquired infections, its prevention and control. So what is your understanding of hospital-acquired infection? Infection, yes, anyone knows. Infection of urine, blood, like that. But what is hospital-acquired infection and why it is important? So before starting, I would like to present this case to you. So just I'll read out this case for you. A 52-year-old male patient who was been hospitalized for past 7 days for a treatment of severe pneumonia. Okay, so 52-year-old male patient hospitalized for past 7 days for the treatment of severe pneumonia. Now, who is on urinary catheter as well? Now, the patient has developed a spike of fever and abdominal pain. So, for that, the patient's urine sample was sent for a culture and sensitivity. Now, this scenario, what tells you? A patient, 52-year-old male patient, admitted for 7 days and admitted for a pneumonia, but uska urine sample भेजा है and the history is given is urinary catheter है patient को. So this is a case of purely hospital acquired infection. How that you'll learn from the next few slides which I'll share and we'll discuss. So I'll be covering this topic under these headings: definition of hospital-acquired infection, what are the types, what are the sources, how to manage hospital-acquired infection and prevention. So to start with, let me introduce what it is and why it is important. So hospital-acquired infection is a major safety concern for both healthcare providers as well as patients. Considering what? Considering its morbidity, mortality, increased length of the stay of the patients in the hospital, and of course the cost.
Excuse me, madam.
Sorry?
Yours, the slide share is not working. It's just at a pause at one place only. Can you re-share it? Share screen.
Is it visible now? Is it visible now?
Yes, it is visible. It is
I
visible.
think the slide share won't work. So is this font okay if I don't go on the slide share mode?
Ma'am, we can see the slide now.
Yes, you can see the slide, but when I go to slide share mode, I think the slides are not changing. So this will do.
Yeah, it will do.
Okay. So why it is important? Like hospital-acquired infection is major safety concern for the healthcare providers as well as the patients. Like who are the whole healthcare providers, such as the doctors, nurses, mama maushi is working in the hospital, technicians. So these are the healthcare providers. So this is how it is important in case of morbidity, mortality, increased length of the stay, and of course the cost that patient bears because of these infection as the length of the stay in the hospital increases, plus the antibiotics, medications, everything. So it's our duty to make efforts to make hospitals as safe as possible for the prevention of such infections. Fine. Now coming to the proper definition of hospital-acquired infection. So these are the infections acquired in a hospital by a patient who is admitted for a reason other than the infection. That infection should not be present or in the incubation period at the time of infection, and these symptoms should appear at least after 48 hours of the admission. So there are the three key elements for the definition of hospital-acquired infection. First, the patient should have an infection after admission to the hospital, and that infection should not be the main reason for what the patient is admitting to the hospital. Then the infection should not be present or in the incubation period at the time of admission. And the third thing is, like, symptoms should appear at least after 48 hours of the admission. Now we will correlate this definition to our case. What was that case? A 52-year-old male patient admitted for pneumonia and was on the urinary catheter, developed COTI, that is catheter associated urinary tract infection. Why? The patient was admitted for pneumonia. So here it's a clear cut case of hospital acquired infection, UTI. How? Because the patient was admitted for pneumonia but developed urinary tract infection. Why? Because of improper putting of the catheter by the healthcare workers. Was the patient having UTI before admission to the hospital? No. Nor the patient was in the incubation period as well. And the symptoms should develop after 48 hours of the admission. The patient developed a urinary tract infection after 7 days. So that case clear-cutly follows all these criteria of the hospital-acquired infections. So apart from these three criteria, there is one more thing that is also considered under hospital-acquired infection. Is these infections should acquired in the hospital, but the symptoms appearing after the discharge. And the last criteria is occupational infections among the staff, like if a nurse or a technician taking out blood and by accident he gets himself pricked, and the next patient, it may be a case of hepatitis B. Now it is again a clear-cut case of hospital-acquired infection. So to summarize, to label a case as a hospital-acquired infection, the infections must occur, first thing, up to the 48 hours after admission to the hospital, up to the 3 days after discharge, up to 30 days after an operation. Can happen if the patient is admitted for LSCS. LSCS होने के बाद patient get discharged, and after 15 or 20 days, patient may come back to the surgeon or gynecologist saying that the wound is not healing. What it is? Yes, it is a case of hospital-acquired infection. And the fourth one is in a healthcare facility when someone was admitted for a reason other than the infection. Our case very well relates to that. The patient was admitted for pneumonia but ended up having catheter-associated urinary tract infection. Now, what is the burden of hospital-acquired infections? So according to the WHO, on an average, 7% of the patients in developed countries and 10% in the developing countries, they acquire at least once in a lifetime one hospital-acquired infection. and out of that, the mortality is of 10% among the affected patients. Definitely, the mortality is more with the immunocompromised patients, patients on the longer hospital stay, and comorbid patients. Now coming to the next slide, what are the factors that affect hospital-acquired infection? ऐसे तो नहीं होगा ना कि then each and everyone will fear कि like if I get admitted to the hospital, I'll end up having the infection. No, not that case. There are some factors which affect the patient acquiring the hospital-acquired infections. These are immune status, hospital environment, hospital organisms, some diagnostic or therapeutic interventions done on the patient, transfusion, and poor hospital administrations. How these factors affect? The very first factor is immune status. So mostly you will agree the patients who are admitted to hospital, their immune status is impaired, maybe because of the disease or maybe because they are on some antibiotics. So in the impaired immune status, they are susceptible to develop hospital-acquired infection. Second is hospital environment. What does it mean? Hospital environment harbors more drug-resistant bugs than the community. So if the patient is developing urinary tract infection from the community, the bug is less resistant. But if the patient is acquiring a hospital-acquired infection, the bug is more resistant because of more antibiotic uses in the hospital environment. Same with the hospital organism. Hospital organisms are more resistant to the antibiotics. Diagnostic or therapeutic interventions done, such as central line डाला है patient को या urinary catheter डाला है, all these interventions matters. Transfusion, yes. If what are the blood products, fluids are not screened properly, you may end up transferring patients some blood-borne infections such as HIV or hepatitis. And the last factor is poor hospital administration. If the biomedical waste is not segregated properly, if the hand hygiene techniques are not there, nurse or the hospital staff is not following SOPs, whatever suggested by the hospital infection control committee, ultimately in that hospital, in that setup, the rate of hospital-acquired infection is going to be more. So all these are the factors which affect hospital-acquired infections. So now, who is at risk of infection in the hospital? The patient, is the healthcare worker, sweeper, or the patients. So everyone in the hospital setup is at the risk of acquiring hospital-acquired infection. How? If the patient of open case of pulmonary tuberculosis is admitted, and if that patient is not isolated properly, so that open case of pulmonary tuberculosis during coughing, sneezing, these droplets they transfer, and ultimately the patients, surrounding people, consultants, mama moshis, visitor, they come in the contact and they may also acquire that infection. So who is at risk of the infection? Everyone in the hospital atmosphere are at risk of infection. But in that again, there are some factors that we have seen in the last few slides: increasing age, greater length of hospitalization, excessive or improper use of broad spectrum of antibiotics, higher number of invasive devices and procedures such as central line, urinary catheter, surgical procedures, they are at increased risk. Plus, the patient with the comorbid conditions such as diabetes, chronic lung diseases, renal insufficiency, malnutrition, these patients are at more risk as compared to the normal patient for the hospital-acquired infection. So till time we have seen the definition, what is the burden, who is at risk, and all that. But now, what are the sources of hospital-acquired infection? Hospital mein, what are the sources? Where from the patient gets bug? So there are mainly two sources: endogenous source and exogenous source. Endogenous involves patient's own flora. So when the patient's immune status is low, so during any invasive procedures, the own flora gets entered into the patient's body. So while putting central line, if the proper precautions are not taken, so skin flora introduced into the body, and if the patient's immune status is low, the patient end up having the hospital-acquired infection. CLABSI हो सकता है या बॉडी हो सकता है या ऐसे हो सकता है. Then comes the exogenous. So what are these exogenous sources? These can be environmental sources, these can be healthcare workers or other patients. Will you please mute your participants? I could hear some background noise. So what are these exogenous sources? Exogenous sources can be inanimate objects used in the hospital, such as BP apparatus, thermometers, stethoscopes. So these instruments, they also act as a source of infection. The air, water, and food in the hospital atmosphere acts as a source of infection. Next, healthcare workers. Who are the hands of healthcare workers harboring
हमारे अंदर से नी हैमर उठाया और अंदर से ये और मुंह बंद कर बाद में बाहर आना है बुढ़ापे में बाहर
Please unmute everyone. Can you put the people on the mute? It's a request, technical team. I could hear some background noise. Please mute everyone.
Acha. Okay, okay.
Fine. Now we were on the sources, endogenous sources and exogenous sources. So endogenous sources, the patient's own flora acts as a source of infection. Exogenous, yes, the inanimate objects in the surrounding, patient's files, stethoscope, BP apparatus, thermometers, they can also act as a source of infection. Apart from that, the air, water, and food in the hospital environment also acts as a source of infection. Apart from that, the healthcare workers, the hands of the healthcare workers harboring MRSA. So if a sister or a consultant is the healthy carrier of MRSA, if not proper hand hygiene done, you end up transferring that MRSA strain to the patients. So this is the case of hospital-acquired infection. And from other patients, as I've told, TB patient not isolated properly, it can act as a source of infection. So this slides shows you that what all things acts as a source of infection, starting from the window, door handles, walls, oxygen cylinder, monitor, patient's bed, railings, everything in the hospital atmosphere can be a source of hospital-acquired infection. Now, what are the microorganisms implicated in the hospital-acquired infections? So mainly these are the escape pathogens, Enterococcus faecium, Staphylococcus aureus, Klebsiella pneumoniae, Acinetobacter baumannii, Pseudomonas aeruginosa, and Enterobacter species. So these are the escape pathogens mainly responsible for hospital-acquired infections. But apart from that, recently you all know COVID-2, SARS-CoV-2, that is we are calling as a COVID-19. It also acts as a hospital-acquired infection. That's why वो patient को isolation करते थे, अलग wards, अलग PPE kit and all that. Apart from that, E. coli, some nosocomially acquired Mycobacterium tuberculosis, Legionella pneumophila. Why? This Legionella is present in the AC vents. So hospital में ACs का servicing ठीक से नहीं हुआ है, या if the proper surveillance, environmental surveillance not done, so this Legionella can be transferred to the patients. Candida albicans, Clostridium difficile, diarrhea. So all these are the examples or the top pathogens which are responsible for hospital-acquired infections. Now coming to the what are the major types of hospital-acquired infection? What patient can get? So patient mainly can get catheter-associated urinary tract infection. As that in our case, the patient was admitted for pneumonia, was on catheter, and ended up developing catheter-associated urinary tract infection. Second is surgical site infection. Post-surgery, the wound is not healing, gaping, pus coming out of the wound. So this is surgical site infection. the patient can also end up in ventilator associated pneumonia. Those patients, ICU patients who are on ventilator. And the last one is CLABSI, that's called the central line associated bloodstream infection. So if the proper care is not taken while putting central line, the wound flora can also get enters into the bloodstream, ending up the patient having CLABSI. So we have seen definition, its burden, what are the sources, what are the major types. Now, how to prevent? Now, this is not done. In the hospital environment, we go with the faith that we will get treatment for the disease that we are getting admitted. But if not taken care properly, the patient may end up having other infection from the hospital. So nor your patients, nor the persons or healthcare persons working in the hospital are safe. So it is very important to have policies, SOPs, administrative control for the prevention and control of the hospital-acquired infections. So what is infection prevention and control? So infection prevention and control is a scientific approach. So it's a scientific approach with the practical solutions which are designed to prevent harm caused by infections to the patient as well as healthcare workers. It's not about patients only, because we also work in the hospital environment. So we also should not acquire these infections. So it's a practical approach, scientific approach with the practical solutions designed so that no one in the hospital environment get any kind of infection. So these are the 7 strategies which will tell you about the prevention of healthcare associated infection. The first one is hand hygiene. Then it comes the environmental hygiene. The surroundings in the hospital should be clean. Screening and cohorting of the patients. So if you doubt the patient is developing cough, fever, so suspect that patient and isolate that patient. Don't let that patient mix with other patients. It can be a tuberculosis, it can be flu, it can be anything. Next is surveillance. You should have a strong surveillance in the ICUs for identification of the hospital-acquired infections, and you should isolate these patients immediately. Antibiotic stewardship, yes, hospital infection control committee, they should recommend the proper antibiotic policy, escalation, de-escalation of the antibiotics, and accordingly, that also helps in the prevention of hospital-acquired infection by lowering the treatment options and lowering the improper use of the antibiotics. Next is following disinfection techniques and safety culture in the hospital. So these are the 7 strategies. We'll see one by one. So prevention of the nosocomial infection, it's mainly responsibility of the healthcare facility. So whatever in the hospitals, the nursing staff, healthcare staff, they should follow recommended guidelines for the sterilization and disinfection. Why it is important? What is sterilization and disinfection? In the sterilization, what are the instruments used for the operation theater, gauze pieces, all the things that should be properly sterilized. So the healthcare staff should know what things to be sterilized where, at what temperature, for how many days. Plus, the ground level staff should know about the disinfection, how to clean the floors, how to clean the rails in the ICUs, how to clean the bed of the patient. So depending on the site where you are working, the type of disinfection, its concentration and the frequency as decided by the hospital infection control committee. Apart from that, there are some general measures for the infection control, that is screening of the ICU patients. If it is developing hospital-acquired infection, that patient needs to be isolated. Again, identifying the type of isolation needed, so which can help to protect others. Observing the hand hygiene, which involves hand washing before and after touching the patients. Then wearing proper appropriate gears, including gloves, gowns, face protection. Cleaning of the surfaces properly with recommended frequency, and make sure all rooms are well ventilated unless these are AC rooms. So there are few precautions that to be followed for the prevention of hospital-acquired infection by the patient as well as healthcare workers. So these are called as the standard precautions. So under standard precaution, what comes is the mainly hand hygiene. Then comes respiratory hygiene. The third one is PPE kit. So with the COVID-19 or with these lockdowns, everyone is very well aware What is PPE? That is personal protective equipment. Then the healthcare workers or technician, they should have a safe injection practices, sharp management, and injury prevention. How? If while injecting, if not proper techniques are used, that healthcare worker may end up pricking himself rather than patients. Sharp, if not disposed properly, the sharp should go in a particular bag. If not disposed properly, the mama maushi who is segregating the waste may have chances of having infection and injury. Safe handling, cleaning, and disinfection of the patient care equipments. Yes, BP apparatus. It should be cleaned with the alcohol swabs. Then environmental cleaning. The food particles, yeah, kachra should not be there. It should be discarded in a proper color-coded bag. Safe handling and cleaning of soiled linen. This is very important. If the patient's bed is soiled with the urination or any body fluid, then how it should be handled? It should not be thrown anywhere. It should be handled properly, and it should be disinfected, and it should go in a proper color-coded bag. And the last is waste management, that is biological waste management. So the first is hand hygiene. As I've told you, for the hospital-acquired infection, hands are the most common way of transferring infection. Like hands, if the stethoscope is contaminated, it may transfer infection to the hand. Then if not hand hygiene done properly, that consultant may see another patient. So you are transferring stethoscope pathogen through hand to another patient. Same with the door handles. If not cleaned properly, they may transfer. Or if a consultant has not done the hand hygiene properly after patient check, he may transfer the infection to the door handles. Medications, mobiles. So these are the possible sources where through you can transfer the infection. So hand hygiene is very important. So it's a single most effective mean of prevention of the horizontal transmission among the hospital patients and healthcare personnel. So according to the WHO has given the 5 moments of hand hygiene. When the hand hygiene to be followed, according to the WHO, there are 5 moments. So these are the 5 moments of the hand hygiene. The first moment is before touching patient. So before touching any patient, that healthcare worker should do hand hygiene. Second is before doing any clean or aseptic procedure, the surgeon, consultant, nursing staff, technician should do hand hygiene. Third one is after doing any procedure. Fourth one, after touching patient. And the fifth one, after touching patient surrounding. That doesn't mean I haven't touched patient, I've done any procedure. But I've taken out patient's file, I've written down the notes. So even after that, you should do hand hygiene. How to do hand hygiene? So for hand hygiene, if your hands are visibly dirty, then you should do hand wash with a soap, water, and single-use towel. And you should wash your hands for minimum 40 to 60 seconds. And if your hands are not visibly soiled, then alcohol rub or hand rub should serve the purpose. In that case, you can use any alcohol-based hand rub, and you should do the procedure for 20 to 30 seconds. So how to hand rub and hand wash? So if they are not visibly soiled, rub would do for 20 to 30 seconds. And if your hands are visibly soiled, dirty, then you should go for hand wash. Next is the use of personal protective equipment. Yes, it helps the healthcare workers from exposure to the blood and body fluids of the patients, or it also protects patients from the healthcare workers' flora during sterile and invasive procedures. So what are these personal protective equipments? As you can see, these are the gloves, heavy duty gloves, N95 mask, surgical mask, cap, gown, gloves, goggle, gum boots. So all these are the personal protective equipments. It not only helps the patient, healthcare workers, as well as the patients from acquiring any type of infection from the healthcare workers as well. Next is respiratory hygiene. some healthcare workers may have a cold or flu and they are on duty. But if they are not following respiratory hygiene or etiquettes, these droplets they spread in the atmosphere, and the patients in the hospital atmosphere are susceptible ones. So they may end up having that infection. So everyone should follow respiratory hygiene or etiquette. So in that, always while coughing, turn your head away from others while coughing and sneezing. Cover your nose and mouth with a tissue paper. If the tissue is not available, then you should always cough or sneeze into the sleeves like this. You should always cough or sneeze into your sleeve if the tissue is not available. And if it's tissue available, then it should be in the tissue and the tissue should be properly discarded, and you should do your hand hygiene. Now, after standard precautions, coming to the transmission-based precautions. So these also help in the prevention of hospital-acquired infection. In that, there are basically 3 types of precautions: airborne precautions, contact precautions, and droplet. So what is airborne precautions? There are some patients who have TB, so tuberculosis, and while coughing, sneezing, talking by that patient, these microorganisms remain suspended in the air as small particles, aerosols, or in the dust, and they remain infective over time and distance. So what happens if not isolated that patient properly? The surrounding may have these microorganisms, and if a healthy patient, healthcare worker, or other patients were coming into the same environment, they end up having these infections. So airborne precautions to be taken because some organisms are suspended in the air as a particle, aerosol, or dust. So such patients should be isolated in the negative pressure ventilation. Why negative pressure ventilation? See, TB is airborne disease. So such patients, if in the ward, then the proper ventilation should be there. If not, the patient ideally should be shifted to the negative pressure room. Negative pressure room, when the so instead of patient's room air going outside, it will suck the outside air into the patient's room. So thus we are protecting the outside environment because of the negative pressure. Then whenever the anyone visiting in that area should wear respiratory protection. They should wear N95 mask, disposable N95 mask that should fit properly around the nose and mouth. So these precautions should be taken for airborne infections. Then we need to take contact precautions as well, because there are some diseases like influenza virus, respiratory syncytial viruses. These infections spread by direct touch or by indirect contact with the infected patients. You never know a patient's flora, body fluid, they are soiled with the infected material. So by touch, if not hand hygiene done properly, they can spread. So what are the precautions? Isolation is required. The patient's non-critical items preferably should be used single use. They should not be reused. So once used, dispose it off. So the handling will be less. And if there are some items which cannot be used single use, so such things should be cleaned or disinfected with a proper disinfectant before using another patient. So एक ही thermometer है ward में. So that same we are not that rich country we will use a single or separate thermometer for each patient. No. So thermometer and BP apparatuses are common. So once you have taken BP for one patient, that is a carrier for MRSA. If not, that BP apparatus cleaned properly, you are harboring the MRSA to the next patient. So the contact precautions should be taken, and the transport of the patient in the ward should be limited. Last one is droplet precautions. So what's the difference between droplet and airborne? Both are same, but droplets are the particles, larger particles, more than 5 microns in size. So these are generated during coughing, sneezing, talking. But only the thing, airborne infection, it spreads a longer distance, but droplet infections, it spreads a shorter distance because of the heavy weight of the particle, it settles down. So for example, COVID, पहले COVID बोलते थे कि droplet infection है, but afterwards the WHO declared it as a airborne infection. So for example, influenza virus, Bordetella virus, severe active respiratory syndrome associated coronaviruses. So SARS-CoV-2 is also an infection which spreads by droplet. So again, in these cases, isolation of the patient is very important. Then while entering the room, the healthcare worker or other patients or visitors, they should protect them with the N95 mask. Respiratory protection should be given so that the patient will not get exposed to the large and small droplets. So now these are the precautions. Apart from that, in the hospital environment, the environment should be clean. The proper sterilization disinfection policy should be there, and there should be a proper biomedical waste management should be done. So this slide, I would like to take 2 minutes. So this is the slide where it shows the segregation of the waste generated in the hospital environment. So this waste should be segregated properly and it should be discarded in a proper color coded bag. So the yellow bag for the infectious waste. All infectious plastic waste will go in red color bag. All the sharps, needles, syringes, blades will go in a white puncture-proof container. And the glass, sharps such as broken glasses, ampules, lap slides, metal implants, all this will go in a blue cardboard box. So such leaflet should be available each and every ward. They should be displayed everywhere. And not only displaying will help the healthcare workers, they should have a proper training over this segregation of the waste. This is an integral part of the prevention of hospital-acquired infection. Apart from that, everything will be followed, like contact precautions हो गया, hand hygiene करेंगे, proper biomedical waste management करेंगे, but that only doesn't serve the purpose. We should have a proper organizational and administrative measures as well. How? In working in the hospital, there should be a proper nurse to patient ratio in the ICU. ICU में 10 beds and only 2 nurses working, no. That may increase the risk of hospital-acquired infections. There should be policies for controlling the traffic to the hospital. ऐसे नहीं कि एक patient है and 10 visitors are coming, they are sitting on patient's bed, they are eating there, they are getting flowers, gifts, not done. The policy should be there to control the traffic. Then there should be proper policy for the waste and sharp disposal that we have discussed. Education and training of the ICU staff about the prevention of nosocomial infection is very important. So there should be a continuous education and training program should be taken. And apart from that, the audit should be done. Each and every department audit karke, they should be informed about the percentage of hand hygiene followed by the department. If they are failing, repeated training and education sessions to be taken. Then ICU protocols should have for the prevention of nosocomial infections. Audit surveillance should be done. Then each and every hospital should have an infection control committee team. That team should follow antibiotic stewardship programs and very important vaccination of the healthcare personnel. So all the healthcare workers working in the hospital should be vaccinated against some common infections such as hepatitis B, yes, swine flu. So last comes the role of hospital infection control committee. So this is a multidisciplinary committee. This consists of medical superintendent, dean, HODs from the various department, pharmacy, canteen, all these people, they come, they formulate few SOPs for that hospital. And this committee is an advisory committee to the medical superintendent. It makes some recommendations to the medical superintendent. In our hospital, this antibiotic should be banned. In our hospital, the organisms are sensitive to this type of antibiotics, so we should not go for the higher antibiotics. Even the low level antibiotics will serve the purpose. So these advisories to be made by the hospital infection control committee to the MS or D. So what is the constitution of HICC, that is Hospital Acquired Infection Control Committee? Here the chairperson is medical superintendent, or if it is a medical college, D. Secretary is HOD microbiology. Hospital infection control officer, it can be any representative from the department of microbiology. Hospital infection control nurse. So this is the pillar of infection control in your hospital. Only making policies, putting it on the wall won't serve the purpose. So your ICN should be very active for the prevention of hospital control infection, that sister or ICN should identify what is the hospital acquired infection case. They should inform to the officer. They should take audit, surveillance, training sessions should be done by ICN. Then apart from that, all the heads from the clinical department, non-clinical department, they are the part of constitution. The nursing superintendent, head of the all clinical staff. Then operating room supervisor, CSSD in charge of the pharmacy, in charge of the hospital linen and laundry, in charge of the hospital kitchen, and epidemiologist. So all these members, they constitute hospital infection control committee. How, like, what's the need of CSSD department? Your all the equipments required, instruments required for the surgeries are to be sterilized in CSSD. So if any infection coming from the autoclave is not working properly, no one is to supervise, no one is to do quality control. So you are giving infection to your patients who are operated. They may end up in the surgical site infection. Now, how to do root analysis? Then the committee will see the autoclaves are working not, the proper quality control is to be taken care or not. So thus they can discuss the things. Same with the hospital linen and laundry. If they are not clean, they are not clean in the particular concentration of the disinfectant and use like that only, you are transferring the infection to the other patients. Kitchen. If the kitchen staff is not surveilled properly, they may be a healthy carrier of salmonella. So the food you are giving to the patient may be carrying salmonella. So your patient is admitted for malaria and end up having salmonella infection. Not done. So all these the departments forming a hospital infection control committee, but mainly the role of ICN and infection control officer plays a vital role in the prevention of hospital acquired infections. The functions of HICC, they'll do surveillance, they will have an audit, they will keep looking on the patient's history, the findings, and they will identify a case as a hospital acquired infection. They will isolate and take the proper precautions. Then they'll follow antibiotic stewardship program. They'll make policies. They will review, update the infection control policies and guidelines from time to time. Now, during COVID time, the HICC must have made the policy that each and every patient coming for the operation should be done PCR for the corona. Like, this is review and update of the SOP. Then education of the healthcare staff, outbreak management. They should communicate with the other departments like pharmacy, CSSD for their problems. And HICC meeting, these members should meet regularly. They should discuss what strains we are isolating in the hospital. These strains are sensitive to what we should give the patients. They should have rounds in the hospital to see whether the waste is segregated properly. What is the distance between the bed? How is the environment? How is the cleaning done? What is the disinfectant used? So all these things are to be done by HICC committee, and they should meet regularly. At least once in a month they should meet, and as often required. So this is the hospital acquired infection control committee team. So with this, we are done with the hospital acquired infection, its prevention and control. Thank you. Any doubts, students?
Any questions, please? We had a very comprehensive lecture on the integration of the clinical infections, HAI, and their control measures, including the administrative measures, and very knowledgeable lecture. And we look forward for the questions from the students. So, any questions? Any questions students can ask? Just present. Ma'am, can you little bit elaborate or little bit give a fair idea on the clinical part, clinical in the clinics, the basic infection control measures students or the budding doctors can take in their clinic?
Sorry, doctors, what are the basic precautions that
Yeah,
doctors
basically
take
in the clinics,
clinic.
in the clinics, it's like the budding doctors, we have a PG students who are going to start their clinics. So some basic care they should take in their clinics.
Basic rule is hand hygiene. So they should always do hand hygiene with the alcohol rub, or if visibly dirty, they should do hand wash. Apart from that, in the they should keep their atmosphere clean, where properly they should use the concentration of disinfectant to be used. If it is their ICU, IPDs, OPD areas, it should be cleaned with a recommended disinfectant at particular frequency. Like in the OPD basis, we don't have such policies and all that. So these are the like few basic things, standard precautions, airborne precautions, hand hygiene. These things should be observed properly. Apart from that, if it is a daycare procedure, then they should look after the biomedical waste management also. Displaying of the color coded bags, displaying of the things to be followed by the IPD staff, like that.
Any more? Any students having any more questions? Yeah. Dr. Aparna, she's asking about the basic instruments used in the OPD.
Okay. The basic instruments like thermometer, BP apparatus, they should be cleaned with alcohol, swabs, SOS before using to the next patient. If not alcohol, you can use spirit as well.
Any more questions, students? You all are going to start your clinic. You can take the advantage of madam here right now. You can ask your questions. Okay, I now call upon Dr. Pallavi Chikle to please give her vote of thanks.
Good afternoon, everyone. I, Dr. Pallavi Chikre, Assistant Professor, Department of Pathology, would like to express my gratitude to all for their presence in this webinar. Today was really a day of learning. I would like to thank our guest speaker, Dr. Shalini Gore, for her sparing valuable time with us. And I thank you, ma'am, for clearing our concepts and enhancing our understanding pertaining to the hospital-acquired infection prevention and control. I would like to thank Dr. G.D.POL, sir, founder of the G.D.POL Foundation, Y.M.T Homeopathic Medical College, for his constant support. I would like to thank Dr. P.P. Page, ma'am, Principal, Y.M.T Homeopathic Medical College, for her enthusiastic support. I would also like to thank Dr. D.G. Bagal, sir, Vice Principal, Y.M.T Homeopathic Medical College, and Dean Faculty, MUHS Nasik, for his constant support. A big thanks to all the participants. I would like to thank teaching and non-teaching faculty for their unfailing support and contribution. Heartfelt thanks to the organizing committee. I would also like to thank technical team, without whom this webinar wouldn't be possible. With these warm words, I would like to conclude this webinar. Thank you everyone for participating.
Thank you, Gore madam, for your support and for your lecture.
Thank you everyone for the patience.